Dr. Eric Topol says digital health is about empowering patients to take control of their health. On this note, the Federal Ministry of Health inaugurated the Implementation Committee for Nigeria's Digital and Health Initiative, saddled with the responsibility to rebuild and reposition the digital health environment, which includes data gathering, data repository, amongst others. The coordinating minister, Professor Ali Pate, before inaugurating the committee, stated 5 important areas the committee needs to focus on, which is improvement of patient experience, cost reduction of care at different levels, improvement of work life of workers, amongst others. He urged the committee to have the spirit of team collaboration.
How can digital transformation help us reduce cost of care by the providers at different levels, or even for the purchasers like NDHI or primary healthcare or hospitals? And using the platform to improve the work life of the health workers themselves, the providers, who are using the tools that will be the outcome ultimately of this work to improve their own work-life experience. And for policymakers and managers to also improve their effectiveness and efficiency and be able to hold actors accountable. Those are the 5 domains that I see, just listening to my brother, as very important areas that we will be expecting this committee to really lead us.
The Minister of State for Health and Social Welfare, Dr. Tunji Alausa, who doubled as the chairman of the inaugurated committee during a speech, disclosed the taking off of EMR platform at federal tertiary hospitals and implementation, says it will be one state per geopolitical zone to gauge its efficiency and accuracy. He affirmed that the President Bola Ahmed Tinubu's vision to have effective and sustainable health care would help save more lives and reduce physical and financial pain for Nigerians.
The Implementation Committee we are inaugurating today will midwife a data policy, regulation, repository management, and serve as ombudsman to establish a national digital health environment that will support the scale-up of our digital health intervention, such as our National Unified EMR platform in the first instance. We will be utilizing existing national digital health policies and frameworks, the National Health ICT Framework of 2015 to 2020, National Health Information Framework, National Digital Health Policy, and National Digital Health Strategy of 2021 to 2025. Members of this implementation committee will be responsible for managing the deployment, architectural design, and pilot of the EMR platform, as well as providing guidance for the coordination, implementation, and execution of the overarching activities at all levels to drive ahead digitalization agenda.
Dr. Alausa at the end of the event addressed press to give more insight on the committee's activities and future plans.
So there are 2 important questions the First Lady asked about sustainability. A lot of things have been done, and that's the thing we've had in our healthcare system, fragmentation. We have people that have invested, even some of our development partners that have invested in digitalization effort in some of our states. Now, we don't have a platform where all these various platforms are talking together, talking to one another. So at the end of it all, it's a whole project of digitalizing our healthcare system. We're starting with the base. And we're starting from the base, which is having an electronic medical record. That's where you collect patient information. Obviously, the other things that are part of it, we have to have a data governance, a data repository, data security, data regulation, and data standard. So these are all part of our digital architecture. Now, you asked very important question, sustainability. Sustainability is what this president stands for. President Bola Ahmed Tinubu, our president, he believes his whole agenda is to turn our country around for the better from now and into the future, so that other government, when this government is gone after so many years, the government that will come, they'll be blaring on the baseline of what the president has built. So whatever the president has mandated us, that whatever we do, it has to be done in such a way that it's sustainable into the future, 10 years, 20 years, 30 years from now. This president is not about superficial work, it's not about patchwork, it's not about palliating anything. We will fix it from ground up. And our digitalization effort is all about that as well. We're developing this. Government is the enabler to develop it. That's why we're bringing in the private sector immediately, so that they can be part of it. That's how we will have sustainability into the future. The government is not going to own the software. The government is not going to own the technology. The private sector will own the technology. That's where that's where we have huge capacity for them to unleash the innate potential that we have in this country. To answer, to layer up to this gentleman's question about, yes, what we're developing now, the government will now own our data. Right now, we don't have a single source data that the government owns. At the end of the haul, the government will own the data itself, but the technology will be owned by the private sectors, because that's why we can begin to have innovation into the future. And that's what will lead into sustainability. I promise you that 100% political will by the government. We, the Supreme Minister, supported the Permanent Secretary, we have at the highest level of our ministry, we have the will to make, and we're giving it everything that this will be. We will actualize this project within the shortest time. Nigeria should not be an exception. It's been done in Indonesia, it's been done in Philippines, it's been done in India. Within 2 years, we will do it as well.
Comfort Olayinka, Eco Hot TV.